With swift technological advances such as genomic sequencing and molecular targeted drug exploitation, the concept of precision medicine has emerged as a beacon of hope and progress in recent years. Precision medicine isn't just a medical buzzword, it's a transformative approach that tailors treatment to individuals based on their unique genetic makeup and biological characteristics. This evolution from the traditional one size fits all model holds potential to revolutionize healthcare. In our pursuit of unraveling the intricacies and potential of precision medicine, we are immensely privileged to have a distinguished guest, Dr. Suhas Kirti Singla, join us today. Doctor is a medical oncologist and a consultant and head at Positron Multi-Speciality and Cancer Hospital, Rohtak. In the era of evolving oncology, Dr. Suhas strongly believes and follows precision medicine, providing the best personalized treatment with minimum side effects and better quality of life. Doctor's expertise perfectly aligns with our mission to bring the latest advancements and insight into the medical world. Hi, I am Dr. Harshita, your host for today's discussion centered around the subject of precision medicine. And Doctor, we are truly honored to have you with us today.
Same here.
Without any further ado, let's dive into a captivating conversation with Dr. Suhas. My first question is: how would you define precision medicine, and how has its approach transformed the landscape of healthcare and patient treatment?
So, precision medicine somehow seems to be a very fancy term, but to be very frank, if we want to generalize it, it's just a personalized medicine. It means that we are not now going that, as you already said, that a single size fits the all, and we are trying to find out the size for every patient in a separate way. So, it is an innovative approach to healthcare that helps you to make a lot of medical decisions about treatment, interventions, and therapies for individual characteristics of the patient. So, what actually it does is it takes into account the patient's genetic makeup or the molecular profile and the lifestyle choices that helps in creating a targeted and effective healthcare strategy. So, it has various applications. If we say it can provide you with a personalized treatment, improved diagnostics, cancer treatment, reduced adverse effects, helping in drug development, preventive care. A very good part of it is involved in preventive care, patient empowerment, data driven insights, and though there are challenges in ethical considerations of the same.
Yes, Doctor. Thank you for shedding light on the concept of precision medicine. And moving ahead, what are some key examples of successful precision medicine application, and how have they led to improved patient outcomes and personalized treatment strategies?
So, actually speaking, precision medicine has impacted every field of medical science. If you look at it, we can do genetic profiling, which helps in better diagnostic accuracy. In these eras, there is a term which is known commonly in oncology, that is carcinoma of unknown primary syndrome. So earlier it used to be only that IHC, that is the immunohistochemistry, that is the outer covering of the cell, which helps us to identify that from where the cancer is arising. Nowadays, now we are going into the era that we'll be trying to find out that according to the genetic makeup of that cell, that how and what type of tissue is actually involved in the cancer formation. And then if we talk about pharmacogenomics, it's very important. Pharmacogenomics is coming up field, though a lot of it has not yet happened in terms of oncology, but it's actually happening in other fields around. Molecular diagnostics is very very important. So in today's era, frankly speaking, treating any patient without a molecular test is actually becoming difficult, and the reason is that in presence of so many targeted therapies available, we have so many hotspots or the biomarkers. We need to identify them, and we need to give those targeted therapies to these patients so that they can actually avoid all the side effects which are commonly associated with chemotherapy during the treatment. So now this is a big boon to the treatment as such. If we talk about that, chemotherapy can be avoided in many of the patients.
Yes, doctor, and it's great to hear about these advancements that have translated into improved patient outcomes and more tailored strategies, truly showcasing the potential of precision medicine. So, doctor, could you discuss any challenges or limitations associated with implementing precision medicine, such as access to genetic testing and data privacy concerns?
So there are many actually. So being in a resource constrained country, we have that issue. A lot of patients are unable to afford that. So affordability is a big issue because still it is in its incipient stages. So because of the same, patients are unable to afford the test which goes beyond their pockets, and most of the test actually cost more than 10k bucks. So patients are usually not able to get it done. But now with as the time has passed, so if we talk about within last 5 years, the rates have dramatically came down, and this has made the scope of precision medicine much wider and much acceptable, as the patients are now being able to afford it. Yes, in terms of challenges in ethical considerations, if we talk about, it is a genetic makeup data. So if in case that shield of protection gets broken, it's going to be a big harm to the patient, because it's one of the biggest private thing which a patient should have in his hand, and the privacy should not be breached. So protecting that is very essential, and it has to be done on the part of the companies or the labs which are doing these tests, that they protect their privacy of those patients.
Yes, doctor. And moving ahead, what role does interdisciplinary collaboration play in the advancements of precision medicine, and how do experts from various fields collaborate to ensure holistic patient care?
So the biggest part of it comes from basically the geneticists who actually guide us sometimes, that for this patient you can have this kind of hotspot test. And sometimes what happens is we go for whole exome sequencing. That means that going through the whole genomic data of the cancer cell, and then at that time we come across a lot of variants of unknown significance about whom we don't know that what to do now. So in that scenario, geneticists are of great help, where they actually help us that to understand whether we should try a therapy according to that or not. And in terms of surgical part, if we talk about, then there is a data coming up that certain patients may benefit from surgery, and certain patients may not benefit from surgery at all if they have particular type of genetic makeup. So this is going to surely change the outcome, and is surely going to prevent a lot of patients from undergoing unnecessary surgeries and unnecessary chemotherapies for that matter, and also unnecessary interventions in that part.
Yes, doctor. And yes, the convergence of the expertise from diverse field is essential in providing comprehensive and well-rounded care to patients. So, moving ahead, doctor, can you provide insights into how precision medicine has impacted patients' engagement and shared decision making as patients become more informed about personalized treatment options?
So patient basically is now more informed and does know what kind of disease they are suffering from, and what targeted therapy they are eligible for, and how they can receive the maximum benefit of the treatment without having a lot of adverse effects. So this helps the patient a lot to understand that if they go for any such kind of therapy which is targeting a particular mutation or a particular genomic abnormality, then it may not be actually affecting their normal cells, which usually used to happen with chemotherapy. And that helps the patient to understand how they can be prevented or can be protected from the adverse events of chemotherapy and other non-selective agents. For example, if we talk about immunotherapy, today is an era of immunotherapy. In these days, newer therapeutic agents in this field of immuno-oncology are coming up on a daily basis. And also, they are being approved, the older ones are being approved for newer indications. So, the immuno-oncology now is absolutely a miracle for the patient, because it is not associated with the conventional side effects of chemotherapy, like loss of hair, loss of appetite, and all those things. So that helps the patient to prevent himself or herself from getting all those adverse effects. So that is very good in that terms. And if we talk about targeted therapy, the earliest one was trastuzumab, which actually changed the scenario of breast cancer. So from there, it came around 20 years back, and from there now the breast cancer scenario has changed to such an extent now that we have, for that particular type of breast cancer, we have at least 5 or 6 agents, and they are doing wonders. And even today the trials are going on for newer agents, and for actually providing better outcomes to the patient. So this helps the patient to understand how they can make a shared decision with us. They can sit along and they can understand what are the adverse events they are going to face with any particular agent, and how they can have this. Another aspect is liquid biopsies. So liquid biopsy is a term which is very confusing, because biopsy is usually solid. So liquid biopsy, what it does is, it actually takes a part of your blood and detects certain amount of abnormal DNA, and then we can follow that abnormal DNA in a proper way of 3 monthly or 6 monthly basis. And there we can detect if a particular genetic mutation which was detected earlier is going down or is going up. That means that if the patient is responding to the particular agent which is being given to the patient, so that helps you to change the medicine, or you can also keep on going with the medicine as per the response. So these are few things which are going to help the patient a lot in making a proper decision about what kind of treatment they can take in these days.
Yes, doctor, thank you for providing our insights. And coming to our next question, as this field continues to evolve, what advice do you have for patients, clinicians, and researchers to maximize its potential in revolutionizing healthcare delivery?
So, in terms of patients, I like to say for every patient that they must meet somebody who understands the concept of targeted therapy or immuno-oncology, so that actually they can drive the maximum benefit of the same, and they can actually understand that what they are going to undergo. And in terms of clinicians, if we talk about, then then clinicians should be actually well informed that how they can help the patient to receive best of the best results with minimum of the adverse effects. So that should be the motto of treating oncology patient, because that is what had been lacking for years together, because we were trying to actually put on our research into the field of chemotherapeutic agents. So chemotherapeutic agents are going to have certain kind of side effect. Now they are the most effective and the most rapid treating options available, but they are associated with their own kind of side effects. And for researchers, I'll say thank you for all your researches, and we are very grateful for the same. We want you to carry out the same, and with the same zeal you had been carrying out, so that we can help the patients to the maximum.
Yeah, thank you, doctor, for sharing your knowledge and insights.
So basically, this is one of those things. Precision medicine is one of those things which is very close to my heart, and frankly, I want everyone to know about it in the world, so that they can understand the importance and significance of the same, and how they can change the oncology landscape. Oncology landscape has changed a lot if we talk about in the Western countries, and yet in India, especially in tier 3 cities, if we talk about, there is still a lot of lack of knowledge of the same. People don't understand, patients don't understand, doctors don't understand. I want to change that scenario. So that's why I want to emphasize that one should understand precision medicine to the greatest extent they can.
Yes, doctor. Thank you, and a huge thank you to our audience for tuning in. And before we conclude, I want to bring your attention to the MedSynapse platform, our vibrant hub that's redefining healthcare landscape. It serves as an invaluable resource for professional doctors like you, offering continuous offering opportunities to engage in meaningful discussions, connect with expert doctors, and be part of advancement in healthcare. So why wait? Explore the MedSynapse platform right now to make the most of these remarkable opportunities. Feel free to drop your comment in the section below if you have any questions. We'll be more than happy to provide you with the answer you seek. Until next time, take care, keep advancing in your medical journey. Goodbye.